know this? Nearly 1 in 2 patients say they leave a medical visit feeling unheard or dismissed. And that number is even higher for women, older adults, and people with chronic symptoms. That's not just frustrating, it's dangerous. This is why patient advocacy, also called patient empowerment, has become one of the most important skills you can learn in today's healthcare system. Patient advocacy means knowing how to speak the language of medicine without needing a medical degree, so your doctor can quickly understand what's happening, make accurate decisions, and keep you safe. Here's the problem most people don't realize. Doctors and patients think very differently. Patients think in stories. Doctors think in patterns, timelines, and probabilities. When those two worlds don't align, it can lead to delayed diagnoses, unnecessary tests, higher healthcare costs, and in some cases, serious medical errors. But here's the empowering truth. You can bridge that gap. When you learn how to clearly communicate your symptoms the way clinicians are trained to listen, you can expedite your diagnosis, reduce unnecessary testing, lower healthcare costs, and make every visit to the clinic or hospital safer. In a moment, you're going to see a short comparison video showing 2 versions of the same patient encounter. In one, the patient is unprepared, uncertain, vague, and overwhelmed. In the other, the same patient is informed, organized, and confident. Watch how dramatically the clarity, speed, and outcome of the visit changes.
Hi, Mr. Hopkins. What can I do for you today?
Doc, I've been having a burning sensation in the middle of my upper abdomen for several months now. I was just sitting in front of the television the first time I noticed it, not really doing anything unusual. It's not always there, but when it starts, it's fairly severe. It lasts hours or even days at a time, and then goes away. But it comes back maybe a few days or weeks later. Sometimes it even wakes me up in the middle of the night. Now, I can't exactly pinpoint what brings it on, but when I have the pain, it gets better a couple hours after I eat something. The pain doesn't really move any place. My appetite's been good, and I've had a little nausea, but no vomiting. My bowel habits haven't changed. I still have a well-formed brown stool every day. I haven't tried any medication for the pain since I know that food usually helps. I'm not really having any other problems other than this annoying stomach pain. I feel great. Oh, my mother and brother also have similar stomach problems. What do you think's wrong with me?
This is a confident and prepared patient. By the time he finishes his last sentence, the doctor will have already narrowed down the list of potential diagnoses. In this situation, there's a strong possibility that the patient has an ulcer. The more confident a doctor is of a diagnosis, the fewer tests and procedures he will need to order. Hi, Mr. Hopkins. What can I do for you today?
My stomach hurts.
How long has this been a problem?
Doc, I've been having stomach pain for a long time.
The doctor might be thinking, okay, I need to try to pin this down some. Let me try something else. Did you first notice this pain before or after January of this year?
It must have been before because Uncle and Lorenzo and Aunt Joey came to visit for Christmas. And I remember that I ate something over the holiday that made me feel terrible. I almost called in sick to work, but I decided to go in anyway.
The doctor might be thinking, well, I know the pain must have been going on for several months because this is May. So where does it hurt?
Yep. Most of the time it hurts under my rib cage, on the right side.
Most of the time? Where else does it hurt?
I don't pay any attention. It just seems to hurt all over.
Well, take a minute and give it some thought.
Sometimes it moves to the middle.
Does the pain ever go through to your back?
Sometimes.
Is your pain constant or does it come and go?
Well, it's not always there. It just hurts sometimes.
How often do you have this pain?
Oh, I guess a few days a month.
Is the pain constant for those days or does the pain wax and wane?
It waxes and wanes, I guess.
How long does it last when it comes?
It usually lasts a few hours, but sometimes it hurts all day and all night.
Is it worse when it begins or as time wears on?
I think when it begins.
Is the onset gradual or abrupt?
I guess it comes on pretty fast.
When you have the pain, does anything make it better or worse?
Not that I can think of.
Have you tried any over-the-counter medication?
Not really. Well, I'm not sure.
Does food make the pain better or worse?
You know, I never paid any attention to how food affects it, if at all. Wait, I take that back. Once I ate a huge beef taco that made me feel awful. But on second thought, it just gave me a lot of gas. When I passed the gas, I felt better.
What does the pain feel like?
All I know is that it hurts like wow.
The doctor may be thinking, okay, I really need to understand this better. Let me try a different approach. Would you characterize the pain as an achy pain, a stabbing pain, like somebody was sticking you with a pin?
It's an aching sensation, probably.
When you have the pain, do you have any other symptoms that go along with it, like nausea or vomiting?
Sometimes I feel like I want to throw up, but don't.
Have your bowel movements changed in any way?
I get constipated sometimes.
How long do you go without having a bowel movement?
Most of my life, I've had a bowel movement every day, but every now and then I miss a day. But last week, my wife made some killer pinto beans, and I ate a ton. You can imagine how that went.
The doctor may be thinking, this is not true constipation. Have you noticed anything different about your bowel movements since your symptoms started? For instance, has the color changed?
Well, recently I have had dark stools, but I thought that was due to eating kale.
Are they black and tarry or just darker than usual?
Doc, I really don't pay that much attention to my bowel movements. That's kind of disgusting, don't you think? I can't even stand to change my son's diaper. I'm certainly not going to examine my own stools. It makes me sick on my stomach just to think about it. Yuck!
Has anything else been bothering you?
Sometimes my right shoulder aches.
Does this coincide with your abdominal pain?
I never noticed.
Which did you notice first, the abdominal pain or the shoulder pain?
I really couldn't tell you.
Do you have any fevers or chills?
Sometimes I get a little warm.
Have you taken your temperature recently?
No?
This encounter can go on and on and on. There are still many other potential questions to ask. Compare this to the first encounter.
What you just saw is the power of a 2-minute medical elevator speech. This is one of the most effective tools I teach patients, and it works in primary care, the ER, urgent care, and even during hospital admissions. Here's how to build yours. Think structured, not scattered. Start with context. What were you doing when the symptom began? Resting? Exercising? Sleeping? Traveling? Next, character. Describe the symptom clearly. Is it sharp, burning, pressure-like, throbbing, stabbing, or dull? Then, location. Be specific. Instead of my stomach hurts, say my lower right abdomen. Next is severity. Use a scale of 1 to 10, where 10 is the worst pain of your life. Then timing. When it happens, how long does it last? Seconds, minutes, hours, or days? Now, associated signs or symptoms. For example, when the pain hits, I also feel nauseated and short of breath. Then duration. How long has this been going on overall? Days, weeks, months, or years? This is different from timing. And finally, modifying factors. What makes it better or worse? Movement, food, rest, passing gas, medication. When you organize your symptoms this way, something powerful happens. Your doctor can recognize patterns faster, order the right test sooner, avoid unnecessary procedures, and focus on what truly matters. That's not just good communication, that's medical self-advocacy, and it can literally change your health trajectory. If you want to go deeper, you can explore Patient Empowerment 101. More than a book, it's an adventure on Amazon. Or take the Patient Empowerment 101, masterclass on patientworld.net, because the most powerful voice in your healthcare journey is and always should be yours.